This is a spirometer. This is a tool that we use to measure lung function. If you are having trouble breathing or feeling a lack of endurance, this is a great starting point for us to better understand how your lungs are functioning. So we're going to show you how this is done if you have a spirometry test done to you in clinic. We've already imported some demographic information into the calculator, and the next step is to use this apparatus to breathe air through it to better understand how your lungs are working. So it had already advised me to start, and then it's going to So then we'll go through that same test 2 more times to get an average score. We then print out that information for you, and then we can track your progress with your physical therapy treatments. Once we have your spirometry results and we've decided that you need some sort of respiratory training, we have these really nice tools in our clinic that you can take home for yourself to start to train your diaphragm. This is used as basically a resistance band or a weight for your lung muscles. So it's a really nice tool that you can keep in the long term to better increase your diaphragm strength. So this device, called an Expiratory muscle strength trainer, is used to increase the strength of your diaphragm. There is a twisting option on this device that either increases your resistance to your diaphragm or decreases the resistance. This is utilized in units of millimeters of water pressure. So on your first appointment with your physical therapist will calibrate the tool at your designated starting point. From there, you and your therapist will work together to slowly increase your tolerance to increased pressure. Your physical therapist may suggest you increase your resistance every week by a quarter turn or perhaps a half turn, but this is something that takes time, but this is a really nice exercise tool for you for home. So now we'll go through proper form of using your Expiratory muscle strength trainer. Your physical therapist may utilize a nose plug if you have trouble breathing, exhaling properly, but oftentimes it's not needed once you start to get the form down correctly. So the resistance is on its lowest point right now. If the resistance is easy to you and you breathe through the device, you'll override the pressure and you'll start to hear a wind tunneling sound going through the device. That's a sign that you can tolerate that pressure well, and it might be something that we want to start to increase your strength. So this would be a relatively easy resistance, so you'd hear this noise. Now, if it were to get more challenging, if we were to increase the resistance, then you'd lose that wind or blowing sound within the device because you're not able to overcome the threshold of the device. So it would sound like this. So we want to find a happy middle ground to a difficult resistance, but not an impossible resistance. An important thing to keep an eye on too at home while you're working with this, keep your cheeks neutral. So if you were to try to pull air through the device like this, you're losing a lot of air within your cheeks and you're not expelling through your diaphragm in your lung space as well. So you can apply a little bit of pressure towards your face just to settle your cheeks better so all the air is expelling into the device. So it looks a little more like this. The standard protocol for using this device at home would be to exercise with this every day. You would perform 5 breaths with a 15 to 30 second rest period between each breath. You do that 5 times total with 2 minutes of a rest between each set, and then you would try to perform that 5 days a week for 1 week, and then we'll start to establish if we can start to increase your resistance or if we need to maintain the current position that we are at. It's very important to keep track of your rest breaks too, because the diaphragm needs a rest just like any of our other muscles. If appropriate, your physical therapist may also prescribe you an Inhalation Trainer as well. This is a very nice tool because it just attaches to your already prescribed Expiratory muscle trainer. So you would take this tool and then you would just attach it to the top portion of your expiratory trainer. You just settle it right in, and then you would be using this apparatus to breathe in to try to strengthen your inhalation muscles as well. So with a lighter resistance, you should hear like a duck sound, a duck calling sound. That's a sign that you're breathing air properly through the device. So it would sound like this. Now, if it gets too challenging, if the resistance is too strong, then you'd start to lose that duck call sound, and that may be a sign that you're over, your resistance is too high for what's appropriate for you. So it would sound like this, where you wouldn't be able to pull any air through the device. The protocols for your inspiratory trainer are the same as your expiratory trainer. 5 breaths, 15 to 30 seconds, 5 sets through with a 2-minute rest period between each. Ideally 5 days a week for a full week until we decide if we need to increase your resistance or keep it the same.